Welcome to Back Facts. In the words of Paul Ingram, the journey to relief begins with better back beliefs. This statement could not be more true. It's very hard or impossible to overcome long-term back pain without upgrading your beliefs on pain and dismissing the misinformation surrounding the topic. So here, we're going to go over 10 back facts published by Peter O'Sullivan and other prominent pain researchers from this article here. Fact number 1. Persistent back pain can be scary, but it's rarely dangerous. I'll be the first to tell you that back pain can be really scary. Most of us don't intuitively have a good understanding of our backs and spines. It's much easier to conceptualize or visualize something like knee pain or wrist pain. But back pain is often mysterious and scary. And it can be especially scary when you have radiating symptoms or nerve pain involved. And when you search these things on Google, you'll be met with all kinds of terrifying images and videos. But the truth about back pain is that less than 1% of all cases are something truly scary or warranting significant medical treatment. And the degree or duration of pain doesn't correlate with the severity of the physical tissue injury. So the takeaway here is that back pain can be really sensitive and scary, but it's rarely medically dangerous. Fact number 2, getting older is not a cause of back pain. It's incredibly common to hear people associate back pain with getting older. It's almost universally accepted that back pain is just a normal side effect of aging. But it turns out that this isn't true. When we look at huge population data samples, we find that incidents of back pain do tend to rise as people enter their 30s, 40s, and 50s. But we actually see these numbers drop off again after these decades. So why might this be? Well, you can think about what most people are doing throughout each decade and what happens in your 40s through 60s. In these years, you're likely in the thick of your career, maybe with a few older kids, and starting to think about retirement in the next 10 to 20 years. For many people, this is also a time of peak stress and decreased physical activity, which is another huge thing that we see in the research. Instead of back pain being linearly correlated to how old you are, we actually see it much more correlated with people's activity levels and fitness levels. So it makes sense why back pain peaks around these decades where you might be moving less and stressing more. But the point is that back pain is not an inevitable process that happens as we get older. It's far more correlated to lifestyle factors and activity than age. So no more using age as an excuse. Fact number 3, persistent back pain is rarely associated with serious tissue damage. This is something we talk about a lot here. It's common to think that pain is correlated one-to-one with damage, injury, or harm. However, we know that most cases of persistent back pain are not associated with physical trauma or acute injury. Now, many cases of back pain start that way, but our bodies are excellent at healing injured tissues. What we're less good at is unlearning the pain associated with those injuries. And that's why you can get stuck in this nasty cycle of neuroplastic pain. By the way, if you're looking for a step-by-step game plan to help you get out of back pain for good, go check out what I do at BackUnbroken. It's helped thousands of people become pain-free, and it could absolutely do the same for you. I'll leave a link down in the description if you want to learn more about it and get started with your free trial today. Fact number 4, scans rarely show the cause of back pain. This is another concept that we talk about a lot here. Scans, so things like MRIs or X-rays, are only helpful in a minority of cases. For most people, scans will show a lot of scary sounding things like disc bulges, herniations, or arthritis. The reality is that these things can't always be accurately associated with someone's pain. This means that if you look at 2 separate scans, one with a lot of those scary things and one without any, you wouldn't be able to accurately guess who has back pain and who doesn't. Pretty crazy, right? It seems like we would be able to pinpoint the abnormalities in a scan and have a solid explanation for the pain. But the research is very clear that these abnormalities are actually quite normal and are very common in humans, whether or not they have back pain. So don't attach your whole identity or pain to an imaging result. It doesn't show nearly the whole picture. Fact number 5. Pain with exercise and movement doesn't mean that you're causing harm. It's really common to think that if you do a specific movement or an exercise and you get an increase in pain with that movement, that you re-injured something or you caused some kind of damage to your body. But again, sensitivity doesn't necessarily mean damage. So having some extra discomfort or pain with movement or exercise doesn't necessarily mean that you're making things worse or causing harm. It might just mean that you're annoying a sensitive area. This is ultimately good news because it means that we can ease into movement and exercise without the fear that we're causing more damage. It's safe and normal to feel some pain or discomfort with exercise and movement. This usually improves over time and is actually helpful for breaking out of this cycle. Fact number 6, back pain is not caused by poor posture. I know, you grew up with your grandma and your parents yelling at you to fix your posture and sit up straight. And it's inescapable on social media. Every other post is about how to fix your posture. However, posture has been very well studied, and it doesn't hold up to the claims that we used to make about it. Posture doesn't directly correlate to back pain or the likeliness of developing it. In many cases, trying to fix your posture or paying a lot of attention to it can actually do more harm than good. Trying to hold quote-unquote perfect posture all day would be like clenching your fist or clenching your jaw all day long. And how's that going to feel after a few hours? But we do this all the time with posture. We try to hold ourselves upright in perfect alignment and maintain some arbitrary standard of posture throughout the entire day. But this is actually much less efficient and more demanding than holding a more slouched posture or a relaxed posture. It's cliche to say, but your best posture is your next posture. Fact number 7, back pain is not caused by a weak core. Just like with posture, we have a lot of research on core strength and its correlation to back pain. And we don't have reliable evidence to suggest that having a weak core causes back pain. In fact, some research even suggests that those with back pain tend to have stronger and more tense cores. And this is likely a protective mechanism. Your nervous system keeps your core guarded out of fear and a sense of needing protection. So can core strengthening be helpful and even reduce pain? For some people, yes. But this doesn't necessarily mean that the pain was caused by a lack of core strength. That would be like saying that headaches are caused by a lack of aspirin. The aspirin might help alleviate the headache, but the lack of it wasn't the source of the problem. Fact number 8. Backs don't wear out with loading and bending. You've probably heard of the concept of wear and tear. It's the idea that the more you bend your back or the more you load it, the more it will wear out over time. You may also hear people compare your body or your back to a car that has parts that wear out over time. But this is absolutely not how human bodies work. Your body is not a car. Living humans follow what's known as Wolff's Law, which states that your body adapts to the stress that it's given. This means that your body, unlike a car, actually improves and gets stronger as you stress it appropriately. As long as you aren't stressing it with too much at once, your body is very good at healing and adapting to the demands that you place on it. So your back doesn't break down as you use it. It actually gets better and more resilient. Fact number 9. Pain flare-ups don't mean that you're damaging yourself. Trust me, I know flare-ups are the worst. Not just because of the pain, but also because of the mental spiral that comes with them. You instantly think that you've lost all your progress and you've re-injured your body. But this usually isn't the case. Most flare-ups are times of extreme sensitivity. They often happen when you have the perfect storm of life and physical stress come together. Maybe you've been mentally stressed lately, and you've been getting bad sleep, and you have a deadline at work coming up, and you haven't been able to work out in a few weeks. And then randomly, you go to pick up your laundry basket and boom, you flare up your back. Instead of immediately assuming that you caused harm to your body, try to see if you can identify some of those factors that may have led to the pain or increased sensitivity. Flare-ups can be awful, but they don't usually indicate significant injuries or harm. Fact number 10. Injections, surgery, and strong drugs usually aren't a cure. A lot of people have the assumption that invasive procedures like injections and surgeries are inherently more effective than conservative treatments. This is actually almost never the case. In fact, many back pain surgeries are no better than placebo surgeries and are often just as effective as a round of generic physical therapy. Furthermore, these things will often prolong the pain cycle by adding a huge layer of fear and fragility to your nervous system. Can things like pain medications and injections be helpful for short-term relief? Yes, sometimes. But they aren't addressing the real issues or roots of long-term back pain. Can surgery be helpful or sometimes even medically necessary? Yes, absolutely. This isn't a specific recommendation or medical advice for you, but think long and hard before you go down this route. And if you have already gone down this route, no worries. You're here now, and you probably already realize the limitations and risks of some of these treatments. All right, thanks for joining me for Back Facts. Again, if you need help navigating back pain and want a real plan to get out of it for good, head to BackUnbroken.com or click the link down below to get started on your free trial. I'll see you in the next video.